This is part 2, post-traumatic stress disorder, the aftermath of trauma. People respond to traumatic events in their own way and according to their individual coping skills and available support systems. Research on the impact of trauma on various populations indicate that the great majority of those not immediately and personally affected by a terrible tragedy sustain no lasting damage. Most of those involved in witnessing or being part of a devastating event are able, in the long term, to find ways of going on with their lives with little change in their capacity to love, trust, and have hope for the future. People can develop PTSD when, out of necessity, they react to and survive traumatic events by emotionally blocking them during and after the trauma. This allows the experience to dominate how they organize their life and often causes them to perceive subsequent stressful life events in light of their prior trauma. Focusing on the past in this way gradually robs their life of meaning and treasure. The description and symptoms of PTSD go all the way back to ancient Greece. However, it was not until 1980 that the cluster of symptoms classified as a mental illness after suffering of Vietnam War veterans was incorporated into the Diagnostic and Statistical Manual of the American Psychiatric Association. The severity of the impact of trauma depends on the age and development of the person and the source of trauma. For example, whether the trauma was relational or caused by a close other, someone outside the family, a natural disaster, war, or things like that. 3 elements of PTSD. The diagnosis of PTSD usually focuses on 3 elements: the repeated reliving of memories of the traumatic experience in images, smells, sounds, and physical sensation. These are usually accompanied by extreme psychological states, as well as psychological stress that may include trembling, crying, fear, rage, confusion, or paralysis, all of which lead to self-blame. The avoidance of reminders of the trauma, as well as emotional numbing or detachment. This is associated with an inability to experience pleasure and with a general withdrawal from engagement with life. A pattern of increased arousal as expressed by hypervigilance, irritability, memory and concentration problems, sleep disturbances, and an exaggerated startle response. Hyperarousal causes traumatized people to become easily distressed by minor irritations. Their perceptions confuse the present and traumatic past, such as that traumatized people react to many ordinary frustrations as if they were traumatic events. The core issue of PTSD is that certain sensations or emotions related to traumatic experiences are disassociated, keep returning, and do not fade with time. People with PTSD seem unable to put the event behind them and minimize its impact. They may not realize that their present intense feelings are related to the past, so they may blame their present surroundings for the way they feel. PTSD can be placed on a continuum for minimal traumatic impact to moderate effects, and to high complex PTSD that include additional symptoms with severe long-term childhood trauma, sexual and physical abuse, In general, the more prolonged the trauma and the more interpersonal in nature, the more severe the impact will be. The trauma continuum. It can be helpful to look at the experience of trauma and the associated impact as being on a continuum. The traumatic event. The single event. A one-time experience. One event that has a beginning and an end. For example, a car accident or surgery. Prolonged family violence. Physical, sexual, and emotional. Neglect or witnessing violence in the household. Colonization or historical trauma. Disconnecting certain cultures from their families, relationships, and cultural practices. Residential school, the Holocaust, or ethnic cleansing. War. Exposure to living in or ongoing violence attributed to antagonists in armed conflict. Systemic rape, arbitrary arrests, shortage of necessities, and executions. The impact of trauma. Traumatic stress. An initial stress response where the body regulates itself relatively quickly after the event. PTSD. Reliving of memories. Avoidance of reminders. Increased arousal. Symptoms are ongoing and becomes the organizing principle of how the person lives. Delayed PTSD. It has the same symptoms of PTSD, but it occurs sometimes after the event, weeks, months, or even years. It can be frightening and confusing because there may not be a clear connection to the symptoms and the traumatic event. Complex or developmental PTSD. This is the most severe symptoms. Trauma has been experienced at an early age in development. The trauma was chronic. It impacts the brain development. It impacts attachment. The trauma involved an individual of close relationship, parent, a caregiver, or a person in a position of authority. It's profoundly disruptive and impacts all relationships of the individual. Those who have fewer traumatic experiences and were able to address the impact of the event either at the time it occurred or sometime later will be closer to the lower end of the continuum. As the frequency and duration of traumatic events increase, so do negative impacts and symptoms. When children experience trauma and their caregiver addresses it shortly after it occurred, the likelihood of developing PTSD is lowered. Complex PTSD is at the far end of the continuum and is characterized by a history of severe long-term trauma that usually includes exposure to caregivers who were cruel, inconsistent, explosive, unresponsive, or violent. People who have experienced trauma struggle with more chronic self-destructive behaviors like self-harm, substance abuse, and suicidal behaviors. Types of trauma. There's interpersonal and external. Interpersonal trauma, such as childhood abuse, whether it's sexual, physical, neglect, psychological, or witnessing domestic violence. Sexual assault, any unwanted sexual contact. And when it has to do with a child, there's no such thing as a wanted sexual contact. Historical trauma, colonization, and the residential school experience of forcible removal from the family home and destruction of culture and language. Domestic abuse, physical, sexual, financial, spiritual, cultural, psychological. Loss due to homicide, torture, enforceable confinement, elder abuse, which consists of physical, sexual, financial, spiritual, cultural, and also psychological. External trauma can be war, combat killing, fear of being killed, witnessing death, and extreme suffering or dismemberment. Being a victim of a crime, sudden death of a loved one, sudden loss of loved one to homicide, sudden and unexpected loss of job, housing, or relationship, living in extreme poverty, natural disasters, or accidents, vehicle, plane, things of that nature. Developmental trauma, child abuse and neglect, and witnessing violence in the home. It's important to understand that while traumatic experience at any time can disrupt attachment, it's not a given. The child may experience a trauma, but have a number of strong attachments, and thus their sense of attachment is not impaired. Developmental trauma includes sexual, physical, and psychological abuse, neglect, and witnessing violence in the home. These experiences can happen during the developmental years of infancy, childhood, and adolescence, and are committed by a trusted adults, caregivers, and or older figure in the person's life. Given that children are completely dependent on adults in their lives for survival, the trauma that occurs at this stage of life deeply impacts identity and shapes beliefs about self the, and the world. Development is severely affected and can result in challenges across a lifetime. The effects of trauma. The effects of being traumatized are very individual, and people who have experienced trauma are impacted physically, emotionally, behaviorally, cognitively, spiritually, neurobiologically, and relationally. Trauma can result in changes in the brain, compromised immune system, increased physical and mental stress, decreased trust, attachment difficulties and conflictual relationships, hyperarousal and hypervigilance, rigid or chaotic behavior. Service providers most often sees hyperarousal and hypervigilance, but may not relate to trauma but may not relate back to trauma and could be misinterpreted. This misinterpretation or misunderstanding of behavior and failing to recognize the fight, flight, and freeze responses can contribute to judgmental behavior on the part of service providers and lead to the development of conflict or adversarial relationships. It's important to remember that trauma impacts the manner in which a person does or does not approach helping relationships and their interactions with service providers. The effects of trauma are felt across a lifespan. PTSD is associated with several physical health problems, including cardiovascular disease, respiratory diseases, chronic pain conditions, gastrointestinal illness, and cancer. It's important to recognize that experiences of trauma can have negative effects on a person's health, regardless of a diagnosis of PTSD. This further supports the ACE study that identified the direct connection between adverse childhood experiences and the increase in serious physical and mental health problems. The ACE study identifies that the more adverse the experience, the greater increase in risk for the following: alcoholism and alcohol abuse, chronic obstructive pulmonary disease or COPD, depression, fetal death, health-related quality of life, illicit drug use, ischemic heart disease, liver disease, risk for intimate partner violence, multiple sex partners, sexually transmitted diseases, smoking, suicide attempts, unintended pregnancies, early initiation of smoking, early initiation of sexual activity, and adolescent pregnancy. Emotional results: depression, feelings of despair, hopelessness, and helplessness, guilt, shame, self-blame, self-hatred, feeling damaged, feeling like a bad person, anxiety, extreme vulnerability to the effects of trauma, panic attacks, fearfulness, compulsive and obsessive behaviors, feeling out of control, irritability, anger, and resentment, emotional numbness, frightening thoughts, and difficulties in relationships. Behavioral issues: self-harm such as cutting, substance abuse, alcohol abuse, gambling, self-destructive behavior, isolation, choosing friends that may be unhealthy, suicidal behavior, violence and aggression towards others. Cognitive symptoms: memory lapses, especially about the trauma, loss of time, being flooded and overwhelmed with recollections of the trauma, difficulty making decisions, decreased ability to concentrate, feeling distracted, withdrawal from normal routine, and thoughts of suicide. Spiritual: feeling that life has no or little purpose and meaning, questioning the presence of a power greater than ourselves, questioning one's purpose, questioning who am I, where am I going, do I really matter? Thoughts of being evil, especially when abuse is perpetrated by clergy, feeling disconnected from the world around us, and feeling that as well as themselves, the whole race or culture is bad. Neurobiological: an overproduction of stress hormones that do not return to normal after being activated can endure for hours or days in ways identified by jittery or trembling, exaggerated startle response, alarm system in the brain remains on, creating difficulty in reading faces, social cues, misinterpreting other people's behaviors or events as threatening, difficulty sleeping, avoiding situations that are perceived as frightening. Part of the brain system changes by becoming smaller or bigger than they are supposed to be. Fight, flight, freeze response, which may look different from person to person, and responses are involuntary. And relational issues: difficulty feeling love, trusting in relationships, decreased interest in sexual activity, the effects of the trauma, emotional distancing from others. Relationships may be characterized by anger and mistrust, unable to maintain relationships, and parenting difficulties. Okay, so we're going to stop right there. And if you have any questions or comments, please feel free to contact me. I'm always here to answer questions. Part 3 is coming up.